Hello and welcome to another session of next Saviours Essential Question Series. Today we are going to have a discussion on a very practical topic, that is identification of the sutures. Majority of the times what we tend to learn for the sutures are their structural characteristics and their indications. But the topic becomes much easier when we identify that the suture is having a needle and a thread. And until and unless we don't know the specific features of this needle and a thread, we cannot reach to the conclusion that where exactly such type of sutures would be utilized. So this is what we are going to learn about. So what are the three possible types of the question that could be asked on the basis of the suture? One is on their identification, that they can give you an image and then they will ask you that what is the name of this suture. For example, in this case, like image below shows a suture material selected for facial closure, violet colored, synthetic, absorbable and monofilamentous in texture, and you have to identify the suture. Second question is based on the characteristic of the suture. Like the suture is synthetic, it is non-absorbable, it is monofilamentous and shows minimal tissue reactivity. What is the name of the suture? And the third one is identification of what is what on the suture packet. Like in this case, the question is based on asking that what is this black dot is indicative of on the suture packet. These are the three sorts of the question that can be asked from the examiners to check your knowledge. Now, first of all, as I told you that the suture material is made up of one, the needle, and second is the thread. So first we'll be talking about the characteristics of the thread. Only the important characteristics on the basis of which you will come to know that which type of thread material is best for this particular organ closure. The thread identification classification, first one is based on the absorbability, like whether it is absorbable suture or not. Now, in a simple term, the absorbable sutures are used when the tissue heals fast and removal is impractical, that you cannot remove the suture later. So that is the reason why it is used in internal organs. And the examples that you have to remember about these are the catgut, the vicryl, the monocryl, the PDS, the Dexon. PDS is polydiaxonone suture. On the other hand, the non-absorbable sutures are used when the long-term strength is required or long-term support is needed, like in case of the skin, in case of tendons, in case of vessels. So examples for the non-absorbable sutures are the silk, nylon, proline, polyester, and even some of the cases like when you are suturing a tendon to the bone, stainless steel threads can also be used. So that is the classification of a thread on the basis of their absorbable nature. Now, this is something that you already are aware of. Second is the classification which is based on the material, that whether this thread is a natural thread or a synthetic thread. Obviously, a synthetic thread is having an advantage of lesser tissue reaction because it is an inert type of the thread. It is having a predictable absorption rates. It is stronger and more consistent as far as the tensile strength of the suture is concerned, and it is having a better sterility and a longer shelf life. So these are the advantages of the synthetic sutures. The examples are vicryl, the PDS, the nylon, the proline, while the natural sutures or the natural threads are having a better biological compatibility, but in some tissues, the only advantage is that they are cheaper and to some extent are more widely available, and they are having a rapid absorption like catgut, which is used in case of mucosal areas. So the examples that you have to remember are the catgut and the silk. But the basic disadvantage of these natural material sutures is that they are having a more tissue reaction because they are not inert type of the suture material, and today they are less commonly used. So threads, the classification of the thread based on the absorbable nature and the material which is used. The third one is the classification which is based on their structure. That means whether it is a monofilamentous, a single thread, or a multifilamentous, that is multiple threads which are braided together. So monofilamentous obviously is having a single strand and the infection rate is lesser. Why? Because there is no space for the bacterial colonies to grow in between the spaces of the threads. So that is the reason why it is good for contaminated or the infected wounds. The examples, nylon, proline, or the monocryl. On the other hand, the multifilamentous suture, the advantages which are provided over here is that it is having a better knot security, it is more flexible, it is easier to handle because it is having a better grip for the beginners, and it is having a stronger tensile strength per size of the thread. And the examples are the vicryl, silk, and polyester. So this is all about the classification of the thread types that we have talked about. The threads. The thread could be one, it could be absorbable or non-absorbable. You came to know about the disadvantages and the advantages of each of them. Second, material which is used for making up this thread. You came to know about the advantages and disadvantages. And the third one is the structure, whether it is monofilamentous or multifilamentous. So these are the characteristic features of the threads. Now, another point of the suture is the needle. Now, needle has to be categorized on two backgrounds. One is what is the point, what is the tip made up of? Like the tip could be a taper point where the round bodied needle is ending up to a no cutting edge. It is simply a taper type of the needle which is having no cutting edge. That is taper point. Now, this taper point obviously is going to be used for the soft tissue closures, like in case of gastrointestinal tract, in case of vessels, or in case of muscles. Then another one is the blunt point, where the tip is obviously a dull tip. It is not at all pointing. Where exactly it is going to be utilized? Wherever there is a friable tissue. Just imagine a tissue like liver. If you drag this needle, there is a possibility of breakdown of this liver tissue. So that is the reason why a blunt type of the needle is used in case of liver, in case of kidneys. So blunt point needle is required. Then the third one is the conventional cutting type of the needle point. Now, conventional cutting is having a triangular cross section throughout with the cutting edge on the inner curve. So here the difference in between the conventional and the reverse cutting is that the cutting edge of the needle is on the inner curve for the conventional, while in case of reverse cutting, the cutting needle edge is on the outer curve. And both of them are used for suturing the tougher tissues like skin or the subcutaneous tissues, or in case of tendons. So hopefully you have understood that the needles are basically identified by their points. That is point number one. Now, majority of the tissue packets are also having a symbol on the basis of which you can identify that what is the type of the tissue needle which is provided inside this pack. Like for a circle is for the taper point, a cutting is identified as a triangle. This is how the reverse cutting and the blunt tips are identified based on these symbols which could be provided on their packets. Then needle is also classified on the basis of their curvatures. You see that a straight type of a needle, which obviously is obsolete today, it is not at all used. This is how it is identified. 1/4 of the circle, which is having a minimal curve, is used particularly for the suturing of the micro organs like ocular surgeries or the microsurgeries. Now, 3/8 of the circle is the most commonly used type of the needle, particularly in case of orthopedic practices and in case of abdominal closures. Half of the circle is having a moderate curve, which is used for deeper cavities where the maneuverability it becomes easier. You do not have too much of the space in order to apply that suture. So just by circling it, you can cover it. And 5/8 of the circle is having a tightest curve, which is again used for the deeper structures like urological or the pelvic surgeries. So these are the different types of the needle curvatures. So threads you came to know were classified based on their absorption, based on their material used, and based on the structure which is used. The needle is classified on the basis of their tip and the curvature. So once we have understood about these sutures, now is the time to identify that what is what as a information provided to you on the suture packet. Now the first one obviously is this, that is 30. What is this? It is the USP suture size. That means the gauge of the suture needle which is provided. Now, you know, this 30 is indicative of moderate thickness, which is used in case of soft tissue closures like bowel or skin, subcutaneous tissues. This is first information which is provided. And larger the gauge, thinner the needle. Second is this SH. Now, what is this? It is the needle code. SH is indicative of a small half circle needle. Below this, we are having the information of 26 millimeters. What is this 26 millimeter? It is the length of the needle. Half circle. This is already we have talked about. That means the curvature of the needle is half circle. And finally, the taper point. The taper point tip, which is used obviously for the soft tissue. So this is the information which is provided to you on the packet itself. Now we come on to this circle, which is outer circle. That means a hollow circle. As we have already talked about this, that this symbol is indicative of taper point needle. And this black dot which is present inside this circle is indicative of needle position. What does it mean, needle position? Like if this is the suture packet, this is the left side and this is the right side. So needle is positioned on the left side. So you have to open the suture from the right side. Now over here, which is hidden obviously, is the brand name. After that is the name of the suture which is there. That is polygalactin 910, which is Vicryl. Then undyed. Undyed means that it is not colored. So Vicryl, when it is not colored, is white in color, and when it is colored, it could be violet in color. So here we are having a undyed Vicryl. So it is indicative of the thread color. Then braided is a multifilamentous structure. It is not a monofilament, multifilamentous structure. Then is the nature of the thread, that is absorbable suture. This is what we have already talked about. Next is this sterile EO. What is the meaning of this term sterile EO? It is actually representative of that this suture is sterilized using ethylene oxide gas. This 70 centimeters is the length of the suture thread inside, and rest of the information is just related to its brand name, the product code, the batch number, the confirmatory markings, the expiry date, and the instructions, which obviously are not going to be asked from you. So these are the information that you should be knowing about what it is exactly indicative of. As far as this color coding of the suture is concerned, you already are aware of that this black color is for the nylon or the silk. This violet color is used for the Vicryl. The blue color is used for the Prolene. The green color is used for the Ethibond or the polyester suture. The brown color is used for the chromic. The yellow is for the catgut. The gray is for the PDS. And the pink or peach color is used for the monocryl suture. So this is color coding on the basis of which you can identify, and these are the sutures which are more commonly used. Now, once we have understood everything about this suture, that means we have understood or we have talked about both needle as well as thread along with the suture packet. Now we to some extent come to a conclusion that where exactly or what type of a suture is going to be used. That means now we have to talk about the principles for the suture selection. If you look at the first one, like if we are having or we are dealing with a fragile tissue, which can be easily broken by a needle itself. So what is the need? The need is that the suture material should be having a minimal trauma to that tissue or should be causing minimal trauma to that tissue. So what is the preferred suture type obviously utilized? It should be tapered. That means the needle should be tapered. It should be a small needle and the material should be absorbable because the fragile tissue obviously would be deeper inside the body. For skin, it should be having a better cosmetic result with a tension. Obviously, non-absorbable suture threads would be utilized of monofilamentous type because they are easy for their application. There is lesser drag damage to the tissue and it is having a less chances of infection. For deep fascia, long-lasting tensile strength is required. For that, absorbable, slow degrading like PDS type of a suture is preferred. For hollow viscera, quick healing is required. No long-term foreign body is also required, and that is the reason why absorbable sutures are utilized for the fixation of the hollow viscera. For vascular anastomosis, the property of the suture is that it should be inert. That means there should be no tissue reaction. For that, non-absorbable monofilamentous type of the sutures are preferred. And for the fixation of the tendons or the tendons to the bone, suture that is required should be having a very high strength, very high tensile strength, and to some extent would be providing a permanent fixation. So non-absorbable like polyester or stainless steel wires are used as a suture material for the fixation of these. So once we have understood the basic characteristics of the sutures, now we have to reciprocate the lecture in understanding that in which tissue what type of a suture material is best suited for. Like first one is the skin closure. Now what is the goal? That there has to be a precise opposition. Like for a skin closure, what is the goal? That there has to be a precise apposition and minimal scarring. So for that, the best sutures to be utilized are the nylon and proline because they are non-absorbable monofilamentous sutures. Monocryl is used for subcuticular suturing, providing absorbable and fine finish. Now the needles which are used are cutting or the reverse cutting needles. For subcutaneous tissues fixation, the goal is to eliminate the dead space obviously. So the suture which is utilized is Vicryl 30 or 20. The needle obviously has to be a taper point needle in order to go for the easy engagement. Next is the facial closure. Like in case of laparotomy, it should be a strong suture because you are providing it onto a slow healing type of the tissue. So the sutures which are used obviously are the PDS, which is absorbable monofilamentous long acting type of the sutures. Now, why not Vicryl? Why PDS? Why not Vicryl? Because Vicryls usually are braided sutures. That means they are having a higher rate of infection, as we have talked about. That multifilamentous braided sutures are having a higher rate of infections, and they absorb faster. And because the vicryls they absorb faster, so there is always a possibility of dehiscence of the fascia before even they get closed. So these are the two reasons why vicryl is not used for the closure of the fascia. Next is the bowel or the intestinal anastomosis. The goal obviously should be that it should be leak proof and providing minimal trauma to the structure. The sutures which are used are the Vicryl 30 or PDS 40, which is having a tapered needle to avoid the cutting of the tissue. And what is the reason? Because the bowels heals faster. So absorbable sutures are fine in these cases. Next is for the vascular surgery. The goal for the vascular surgery that there should be no thrombosis and there should be minimal reaction by the suture material. So the suture which is used is Proline 60 or 70 monofilamentous inert sutures. These are, and the needle obviously has to be a tapered sort of a needle, not the cutting edge needle, for the delicate control of the repair. For urological surgery, like for bladder repair, the suture which is used is Vicryl or PDS 40. The reason, these are absorbable, they are soft, and they are non-irritant. For liver or for spleen, the goal is to avoid tearing the fragile tissue. We have already talked about that there should be no tearing because these are the fragile tissue. So the tearing of the fragile tissue has to be avoided, and that is the reason why a blunt needle, chromic catgut or vicryl is utilized because blunt needle avoids slicing through the soft tissues. And for the orthopedic or the tendon repair, as we have already talked about, that the goal is to have a strong and a permanent hold, which is achieved by either using a polyester or a stainless steel wire because they are having a higher tensile strength and they are non-absorbable. So, in a nutshell, what are the preferred sutures which are used for the purpose of closing the specific organ? For a skin closure, you can go with the nylon, proline, or monocryl. For fascia, PDS. For GI, vicryl or PDS. For vascular surgery, it is the proline. For tendon repair, the ethibond or the proline. The bowel ligation, it has to be chromic catgut. For sternotomy or the bone firing, again SS, that means a stainless steel type of the sutures, which comes in some amount of the gauges. Now, once we have understood this, now it becomes much easier for answering these questions that I posted in the beginning of the lecture. Like a surgeon is preparing for the midline laparotomy closure. The image shows below is the suture material which is selected for the facial closure. It is violet colored, synthetic, absorbable, and monofilamentous in texture. Which of the following suture is most likely shown in this image? If you go with the option wise, like the vicryl, is absorbable, but it is braided. That means it is not monofilamentous, it is multifilamentous. So it is not the answer. Second, catgut is brownish, it is not pinkish, and it is a natural material made suture which is absorbable and it is not synthetic. So this also is ruled out. Now PDS, that is polydiaxanone, is violet or clear. It is a monofilamentous synthetic absorbable type of the suture which is best suited as far as the answer for this question is concerned. And the prolines are blue in color, right? They are synthetic, they are monofilamentous, and they are non-absorbable. So for abdominal fascia, as we have already talked about, the hint is provided that for abdominal fascia closure, there is a preference given to PDS over Vicryl because the PDS is having a greater tensile strength and slower absorption. So answer for this question is C, that is PDS. Another question is that which of the following suture material is synthetic? It is non-absorbable, it is monofilamentous and shows minimal tissue reactivity, making it ideal for vascular anastomosis. So answer for that question obviously is the proline, because silk is natural, it is non-absorbable, it is multifilamentous, that means braided, and it causes moderate tissue reaction because it is synthetic type of the suture. Vicryl, on the other hand, is again synthetic, but it is absorbable. It is multifilamentous, that means braided, and it causes moderate to means low to moderate tissue reaction. And the nylon obviously is a synthetic non-absorbable monofilamentous suture which is used for the closure of the skin. So proline is the best suited as far as this characteristic of the sutures which are asked in the question is concerned. And finally, another question is that while assisting a surgical procedure, a nurse is handed a suture foil pack with a small black dot visible on one side of this packet. This is what we are talking about and what it is indicative of. And we have already talked about this, that it is indicative of the needle position. That is, this black dot is identifying that in which position the needle is placed so that it ensures the proper and safe opening. So always you have to open the pack from the opposite side from the black dot in order to avoid accidental needle stick injury. Now quickly we also have to talk about that what are the sutures which are preferred in case of ocular application, that means eye. Like in case of cornea, the nylon or proline is used because they are fine monofilamentous, which is having a minimal scar and they are providing the long support. For conjunctiva, Vicryl 80 because they are absorbable and they are used for the closure of the soft tissues. For sclera, the nylon or the proline 90 because of again strong, precise and low inflammatory rate. For the skin of the eyelid, fast absorbing gut 60 or nylon 60 are used for fine cosmetic closure. For iris or the ciliary body, proline is used. For frontalis sling, the silicone sling or the marceline is used because of having long-lasting, non-absorbable support. So hope you have learned something new out of this topic. Hope you would be able to answer the question asked in relation to this topic correctly. In order not to miss any update, please join our Telegram group. The link is provided to you in the description. All the best.